I'm Dr. Shafiq. I'm a spine surgeon by profession, and I'm the co-founder and CEO of Trilife Hospital, Bangalore. In our industry, the health industry, there has been always challenges, and one of the major challenges was the attrition of the core team members. And if you look at the hospital, we have the doctors, we have the nurses, we have mainly the paramedical teams, what we refer as the technicians. It is in these two sections, that is the nurses and the technicians, where we have heavy attrition. And post-COVID, there has been heavy hiring from the European countries, because of which we lost quite a lot of our good staffs. So, in an industry where it is heavily demanding, maintaining the quality, at the same time, trying to keep our people together has always been a challenge. So attrition is one of the main challenges we currently in our country is facing, because the children feel that they have a better opportunity abroad. So if we are able to, as the leaders of this industry, if we are able to realize this issue of theirs or the concern of theirs, and if we are able to figure out some ways where we are able to show that there is future in our country, then this attrition can definitely come down, and invariably we will be able to maintain high standards because we have regular people working at regular hospitals. One of the other concerns what we have in our industry is a bit of a disconnect between the medical teams and the non-medical teams. Let's say we have a concern or a patient who has a concern, and it's happening right at the ward floor. Now the normal trend is like you might have a lead nurse there standing there, but since the patient has got a concern, it's not her who interacts and try to sort out the issue. They expect the customer care professional to come on board. Now my point is that there is no better customer care professional in the ward than the lead nurse or the nursing team itself. So if the medical people are trained to do quite a lot of the non-medical things like customer interactions, problem solving, anticipating things, it can make a huge impact in our industry. And this also proves as an opportunity for these medical people also, because I've seen quite a lot of nurses who can actually communicate better than doctors, and their nature, the compassionate behavior makes it more effective than actually a doctor. So these people can become very good customer care professionals or any other place apart from the bedside where there's an interaction happening with a customer. So I feel there is a real vacuum there, and provided all the the hospital management, if they're able to recognize that the very fact that the medical people can do quite a lot of the non-medical things, I think this can close the gaps. This new word called the corporatization, and I'm a doctor and I've been brewed in this. So all of a sudden, when I was working in one of those corporate hospitals, one fine day the CEO called us, and we were given the new tag saying that it's no more patients, it's no more customers, it's your clients. We didn't know what was happening at that time. We were surprised that we were asked to address them as clients and customers. Back then it was always patients for us. That was the beginning of corporatization. I'm talking about 15 years plus behind. Now what is happening is, now this has become hospitals. The good old nursing homes have become hospitals, and now the hospitals are become a kind of an industry where for many it's kind of an investment, for many it's growth, for many it's success. So as an insider, as a doctor, what I feel is there's a tug of war between the corporatization methods and the good old the hospital people, which is us, the doctors and the nurses and things. Now we are confused. Which way are we supposed to go? Because what we have been taught fundamentally is to be empathetic and be good with your clients and understand their emotion, because everything around in a hospital is around an emotion. If you're able to understand the emotions well, then you end up, giving a very good care and service to it. But in this era where everything is towards a growth related, I think there is a real hit on the empathetic part, and I would say in the right sense, the family feel is going away, because yes, teamwork is important. We are not B school graduates, or we are from medical schools. What we understand is the value of togetherness, what we call it as the family. So I feel somehow, somewhere, the component of the family feel is slowly, fading, and everything is going as per charts and growth and many things which we don't understand. So we would like to bring back that empathetic part, the empathy, your willingness to understand the emotions, and this can give a lot of difference in the quality of care you are giving to your patients. Our journey in the hospital industry started off as a small clinic. It's about 12 years back, and 12, 13 years back. We started off as a small clinic, and me and my partner, Dr. Prashant, who's a robotic surgeon, back then we were working somewhere else. We finished our studies and we were working in one of the major hospitals. But we realized that, this area of North Bangalore was lacking a good facility. So we started up as a small clinic, and from then we grew, and in a matter of about 10 years, now we have about 200 beds, and we have offering about 30 plus department services. And we started off with 2 doctors, and now we have about 137 consultants on board, and we have about 800 staffs who's providing this service. And where we are we're able to make a difference from our so-called other hospitals in this locality is the very difference that, since we were doctors and we were responsible for everything, we've been always patient centric, and more than anything we always gave importance to the patients and their concerns. And we have been quite innovative in our in the model of practice also, where every time there was a requirement in the community, we got in and we fulfilled it. Let it be a 24/7 pharmacy, or one of the first cath labs, or one of the first the molecular labs. We were always trying to understand the need of the community, and we've been fulfilling it. And one of the reasons why we've been successful is because we understood what the clients want, and we've been following it very honestly and very sincerely. So this model where we started off a healthcare facility in a locality where there was not much of facility at all, and this has really gone into us, and we take a lot of pride in setting up the whole state of the art healthcare in North Bangalore. So now we as doctors, we are have a vision that we should take up these 2 similar geographical areas where there is not much of good facilities. Let it be within the city, and we are also very keen to get into tier 2 cities, because we have got friends working there, but most of them come to the city because they don't have the proper infrastructure. So we would like to take it to the other parts of Bangalore. We also would like to take it around Bangalore, where we have a lot of tier 2 cities, towns precisely, which needs a quality care. So that's the dream what we have got, and in the next 4 to 5 years, we are looking at adding up another 1,500 beds in about 4 to 5 locations, which we have already seen. And with this patient-centric focus, we're very confident that we will be able to deliver that.